Good morning. Our today topic is about the disease, the general concept of disease, how disease occur, its classification, is like etiology and its pathogenesis. So let's begin to our lecture. Pathological physiology is the science which studies the general lawfulness of the disease genesis and development at the end. As I told you earlier in the previous lecture, it is the definition of the simple pathophysiology. So the pathological physiology is related to the other sciences like to the science which study the illness causing environment factor like chemistry, biology, microbiology, etc. To the science which study the organism properties and its vital functions like cytology, embryology, like we study histology, anatomy, normal physiology, biochemistry, immunology, and to general theoretic science which study and the disease pathological anatomy, pharmacology, and in common with the pathological physiology to create a total picture of illness. So the problem arise in clinic, give necessary material for their solvation to the pathophysiologist. The pathophysiology as a scientific medical base establishes illness, etiology, and pathogenesis and determines the main direction of the prophylaxis and cure of the case. So the medicine use clinical epidemiology, anatomic, and experimental disease study method. So it is a kind of experimental disease model in an artificial reproducing of the disease up to the laboratory animals, which has some lines of proper human disease. So a pathological physiology consists of such parts, the general pathology and the pathophysiology of the organ and the system. The general pathology unites the such part as nosology, pathogenic environment, factors, action, inner factors, role in pathology, and its typical process, the typical metabolic disturbance. So the general nosology induces such notions like health, disease, pathological process, pathological state, and pathological reactions. Health. What is health? Health is a condition of complete physical, psychic, and social well-being. Doing, but not only disease or physical defect absence. In doctor practice, activity determination is used according to which health is condition of a norm. There is a question that what is the norm? There are two approaches to the notion determination, the statistic and the general physiologic one. According to the first one, the norm condition, which is the most frequently observed among the people. According to the second one, the norm is the biological optimum of the organism introducing or functioning the development. The second determination reflects the scientific approach to the notion is a norm, which is a norm. However, the approach remains the unrealized because of our knowledge and possibilities limitations. It is the state of health being according to the World Health Care Organization. The disease. A disease is a disturbance of human organism vital activity under the influence of extraordinary factors of external or internal environment, which is characterized by lowering of capacity for work and adaptation, which simultaneously mobilization of protective forces. It is a state of disease in which a normal function does not feel comfortable. So, nosology, the new qualities created in the disease because of the quantitative changes and qualitative transition. As a rule, there are two contrary processes, two phenomena of the disease. One of them is damage, and the other is called the protective response of organism, which make the first one perform to the physiological measures against the disease. The second one is the pathological proper, the damage. The two beginnings of disease exist simultaneously, as you know action, and as you know every action has a reaction. So for example, in case of cells we see limited in necrotic tissue area, but we can also see the leukocytes emigration in like in inflammation. So about inflammation we will talk We will talk later in the later lectures. The disease classifiers are based on the following criteria: the etiological classification found on the cause of community for the disease group. The topography anatomic classification is based on the organ principle, the like cardiovascular disease, kidney disease, nervous system, etc. And the age and sex disease classification. There are children disease, senile age disease, the female genital disease are studied in the gynecology, as we know. The etiological classification, it includes the proceed from the human dwelling condition like air temperature, atmospheric pressure, the sun illumination. The classification according to the pathology are the pathogeny of the commonness, allergic reaction like the anything that affect from the outside, like you have to your body feel like it's a pathogen in the sense of disease, like allergic reaction, inflammatory disease, neoplasm, shock, hypoxia. Every disease is affecting the whole organism, irrespectively to diffuse the organ and the tissue damage. Pathological process is combination of local and general reaction which arise in organism, retaliating to the morbid agent damaging action. There are like most of the destruction processes combination and protective combination reaction which arise at a different organism level because of pathogenic factor influence, such as the molecular, cellular tissue, organ, and the organ system levels. The example of such processes like inflammation, neoplastic process, local blood circulation disorders, hypoxia, fever, etc. The pathological state is the pathological process which develops more slowly. It is a slow process which develops more slowly, like day by day. Here with the sickly violations remain invariable during a long time. Frequently, the pathological state in the is the result of pathological process. So the inflammation of the cornea may turn into the formation of leukoma. Like it is a kind of example. For example, cancer swelling can be formed under the influence of the cardiogenic factors in cardiogenic or carcinogenic factors, like the place of the afterburning scar. The pathological reaction is an inadequate, the biologically expedient answer to the organism are its symptoms usually on the excessive irritants influence. The pathological reaction is the destructive element of the pathological process. There are four periods of the stage are sometimes the four stages of the disease, like the latent incubation, the prodromal, express clinical signs periods, the disease ending. So such as it is a beginning, the stage of the is proper, the end. Like whenever a disease enter into the patient or the human being, it includes such kind of stages like I told you: incubation, the prodromal, the express clinical signs periods, and the disease ending. Such divisions arose after the clinical analysis to acute infective disease, the scarlet fever and the abdominal typhus. The other disease, cardiovascular, endocrine disease, tumors, course, and other lawfulness. It distinguish the three development stages. The beginning, the middle stage means the disease of the proper, means in which like the disease on its full peak, like on its full peak, and the end. The disease ending are the following convalescence, recurrence into the chronic or transition. That it is very much simple as it is writing in the slide. So the convalescence is the process which conduces to the violation of liquidation causes by and disease and a normal relations with environment, restoration for the human being. Where most the ability to work, restoration. The remission is the temporal state improvement of the human being, which is displayed by the disease progressive slowly, slowing down or the cessation. The partial result, the pathological process, clinical signs, is the remission of the disease. The process of the transition. The recurrence is the new disease display after seeming or incomplete cessation. The complications as disease show their complication in a body is a secondary as the reference to the disease pathological process. The transition is the chronic form and signifies that disease course slowly, more with the protracted remission period, months and even years. So many diseases acquire chronic nature in the old, chronic pneumonia and chronic colitis, etc., etc. So the terminal states are the boundary once between life and death. There is also other time which include the few stages: pre-agony, agony, clinical death, and the biological death. The pre-agony is characterized by the diverse duration. Focus on the sentence, the diverse duration during all days of the deep violation of the vitally important organism functions like dyspnea, decreasing of the arterial pressure, etc. The agony is characterized by the gradual turning down all the organism function. Agony lasts for 2 to 4 minutes, sometimes more. The clinical death is such a condition which, when all of the visible sparks of life has already disappeared, the breathing and the heart means clinical. That means when patient has no sign of the life, like no the breathing and the heart work is ceased. However, metabolism still continues. The life can be stored on this stage, and the biological death. Two things: the clinical death, it is a stage where the patient can restored, but on the clinical or but in the biological death is characterized by the irreversible changes in the algorithm. Irreversible, not reversible. It is irreversible. The reanimation in the organism includes number of the measures which is directed foremost the blood circulation and the breathing renewal, heart massage, artificial lung ventilation, heart defibrillation. The indirect heart massage is widely for the renewal of the blood circulation. It can be used for clinical that setting in and condition even not by the specialist. It is a kind of all the things which we have to do when a patient is around to go about the clinical death. This is all the things like artificial lungs ventilation, heart massage, etc. The etiology and the pathogens. Etiology is the learning about the disease, beginning, causes, and condition. It is the learning about the disease, beginning, causes, and conditions. The notions of causality and the determinism are base of etiology. The causality reflects the objective existence of phenomena connection, which one phenomena inevitably cause beginning of the other phenomena, as it is all discussed in the etiology and the pathogenesis. Nosology, the factor without the disease cannot arise in and condition must be cause of it. Must be cause of it. So, as a factor can be cause if it exists objectively, irrespective of the consciousness corporate with organism in part specifically to the disease. However, when the concentrated man arises from the principle of the, like it is most kind of simple at terms which we have to understand the pathophysiology subject. So be focused on this, guys. The condition of the disease beginning and different factor combination where no one absolutely necessary for the development. As I told you, it is a simple concepts of disease and its happening. So be focused on it and please clear all the concept about these short terms. After that, you will have a brief knowledge about the pathophysiology. So like the condition which increase the causation action, the condition which weaken the cause of action and prevent the disease development. Simple as that. So the classification of the etiology factor is the exogenous factor, like physical factor, chemical factor, biological factor, psychic factor, social factor, and the endogenous factor. Endogenous factor include the factor in the body, like hereditary, constitution, age, sex, organism reactivity. Exogenous means outside, like physical, chemical. Physical mean the mechanical influence, radiation, high and low temperature, etc. The chemical mean inorganic and organic compound. Biological means the viruses, bacteria, protozoas, all the things. Psychic means a word and any kind of thing in which the patient is suffering about. And the social development level, tradition, and others. So simple as that. when the like as I say, there are exogenous and endogenous, like external factors and the internal factors. Like internal factor, like hereditary disease, like as we talk about this, some kind of diabetes mellitus, or any kind of other diseases which are transferred from parents to the offspring. The constitution, age, sex, some of the disease are totally related to the sex, like male and female. Some of disease are present in male other than the female. So organism reactivity. Risk factor are the factors combination the presence of which in people population statistically increase morbidity of the definite disease, which statistically increases morbidity of the definite disease. The belonging of these those conditions to the risk factor is determined by the epidemiological methods, which reveal the large people contingent. So it is a risk factor. Risk factor is about the combination of the people population, means you have to say about the statically increase the morbidity of defined disease. After that, the general pathogenesis. The pathogenesis is the study of the mechanism of development. Pathogenesis is the study of mechanism of development of the disease. So the course and the end of the disease. It is necessary to mention the following questions. The role of etiological factor in the disease in development, the organism, reactivity, significance for the disease beginning of the course, like all the things we have discussed in the general pathogens, like the basic link of the pathogen casually, the significance of the function and morphological changes, the significance of the nervous system, uh, and the changes in the nervous system for disease development. So after that, there are three variants connecting between the cause and pathogeny. The etiological factor plays pushing role to turn the pathogen on. The further existence is not obligatory for the cause of pathogen. The existence of the cause and the pathogeny continues while the etiological factor. The persistence of the etiological factor, the agent caused by the disease, stay in the organism longer than the pathogeny, continues here with the properties of the etiological factor can interchange under the dominance of the organism, like bacteria carrying after the infectious disease. Pathogenesis, the pathogeny of disease always include the two types of process and phenomena. On the one hand, it is damage, destruction, that is properly pathological changes and process that include a a violation of homeostasis. The like the balance between the internal and external body temperature is called homeostasis, as you know earlier about this term. On the other hand, we this is a protective adaptation reaction and the processes. Like adaptation is the suitability of the organism and its structure environment condition changing. It provides the preservation of homeostasis and prevent the damage of environment factors influence the condition. Like adaptation means it is a like a slow and small process that prevents the damage of environmental factor. It influences the condition, and compensation is a state which develops as a realization result of the compensatory reaction and the processes. So the directed to the renewal changes homeostasis along with the pathogenic factor influence. The compensation liquidates the damage of the consequences. Adaptation and compensation. So the base and the compensation are the same mechanism where we need the protective adaptation, as I told you in the previous slide. So adaptation and compensation, the stage of the immediate adaptation and compensation to mobilize the existence of the mechanism and reverse begin. Like it include the stages like as I told you, the action of the pathogenic factor. After that, the violation of the homeostasis. Um, the preparation of the homeostasis violation and the regulatory center, immediate protective reaction, the hyperfunction of the proper structure, this causing to the homeostasis. The pathogenesis, the change in the organism which arise during the disease development definitely causally investigate the relation. It means the same phenomena of the pathogeny as the result of the violation of cause of the other side. So the pathogenesis is mainly linked to the pathogeny is the process which is necessary for the development of the rest. In pathogeny, specifically unspecified the processes and the mechanism are always combined. The unspecific ones are determined by the genetic organism properties. Connection between the local and in general pathogeny. The local variation developed originally. They can be bring uh, like the general changes in the body, proper conditions. So inflammation, neoplasm burns are the local violations. The general violations that develop originally, they can be displayed as general changes so in diabetes, like general disease and the local processes, defeats of the joints, nerves, kidneys, eyes, in the same as we talk about it. So this is a explanatory thing about the disease, its stages. After that, the causality agents, the pathogenesis means the development of the disease. So in the, this is the topics about the general pathology. After that, we will slowly move to the systemic pathology and we'll talk about the systemic pathologies of the body.